Well, it continues to be Breast Cancer Awareness Month, and physicians at the Family Medicine Center reminding women tonight of the benefits of early detection. Our Crystal Darling has more on this.
With the average age of diagnosis in the Bahamas at 42, there's a major push from local healthcare professionals for Bahamian women to have their breast cancer screenings annually. Family Medicine Center physician Dr. Tanya Roker-Davis says that although they haven't seen much of a change in recent data, the threat of breast cancer is too great to ignore.
300 cases of breast cancer are diagnosed each year, according to the health officials, and it could be anywhere from 300 to 500 new cases. About 48% of those cases, the women are under the age of 50. While increasing age is a huge risk factor for breast cancers, here in the Bahamas, we see a lot of younger women being diagnosed with breast cancers, and a lot of it is hereditary.
And with hundreds of women being diagnosed with breast cancer every year in the Bahamas, Dr. Roker-Davis says she encourages them to get their annual breast cancer screening.
Just because you don't have that gene, remember now, the gene, especially in our population, it has resulted in women presenting earlier or younger in age with breast cancer. That doesn't mean that because I don't have the gene, I can't get breast cancer. You still can, but it may not be related to that particular gene or the mutation of that gene. So screening definitely is key. I don't want you to forget or neglect examining your breasts yourselves at home. A large number of women have presented to their healthcare provider because they felt a lump or something simply didn't look right or feel right in the breast. And then we were able to get the necessary screening and imaging done to prevent cancer. So you want to look at them, you want to feel them, get to know your breast, get to know what the normal feel is, so that if a lump or something appears, you can then come to your physician, have an exam, and have your mammogram or your ultrasound done.
And FMC radiology supervisor Dr. Melanie Obregon says nowadays there's more accurate and precise screening tools with less radiation, like their 3D mammogram. She compares it to the traditional 2D machine, which would require more pressure on the breast to produce 4 images. On the other hand, the 3D scans produce between 30 and 300 pictures in total and is less painful.
As we do get more pictures, we don't have to compress as much. So the compression basically is based upon the thickness of the breast, and it's done on a touch sort of perimeter. But just to give you an average, with an older 2D machine, we have to compress quite flat to spread out the breast tissue to be able to see straight through, to hopefully be able to see everything that's hiding inside. With a 3D machine, we don't have to press as much because we get multiple images, almost every millimeter or 2 millimeter, as it goes through the entire breast tissue. So we get to see the outside of the skin, the pores on the skin, the hairs on the skin, straight through, right down to the other side of the breast. So it minimizes anything that might have been missed with the older 2D machine.
And in support of early screenings, Dr. Roker-Davis echoes the old adage, prevention is better than cure.
With advanced technology, we're picking up on the disease process earlier. So hence again why the screening and going all out for Breast Cancer Month. So the recommended age for screening for women is 40 years of age, and it is hoped that we actually pick up these cancers before the patient experiences signs and symptoms, or before your physician actually feels a lump in the breast.
The family medicine physician adds that although they have not found out any definite causes for cancer and how to 100% avoid it, holistic practices always help.
So healthy lifestyle plays a role in any disease entity, any disease process. You always want to be healthy, and the healthier you are, the more prepared you are to fight whatever disease comes your way. So we always encourage, first and foremost, a healthy diet, exercise, drinking lots of water. Those are the basic necessities or the foundation for preventing any disease process.
The Family Medicine Center will be providing breast cancer screenings all month and encourage women to come in for their annual screenings. Crystal Darling, Eyewitness News.